Being fair to every patient means individualized care tailored to each patient's needs. Sure, this sounds obvious, but my experience has shown me that it's not always what happens. You get busy, you cut corners, you make quick decisions instead of the right decision. Let me explain. And stay until the last point when I tell you the 5 things every patient wants. The first element of fairness is being aware of the evil of money. Be fair to every patient means it's not just about the money. There are obvious ethical principles that physios follows, like truthfulness, fairness, and avoiding bias. But when there's money involved, we need to balance our ego with our financial needs. I know it can be a struggle to bring in enough money, but it's wrong to squeeze the patients to buy a TENS machine or buy orthotics or use their insurance for every last visit. This isn't being fair to the patient. I think this happens a lot. You should be aware. The second element of fairness is knowing the marginalized. We know we should avoid bias and provide individualized care. The obvious prejudices to avoid are race, gender, and ethnicity. But in physio, I have seen more subtle bias against these marginalized patients. The chronic repeat patients, the low IQ or perceived low IQ due to language barrier, and the poor prognosis patients. All 3 of these groups tend to be undertreated in physiotherapy. Every patient needs a fair kick at the can. I recommend using rules of thumbs, protocols, and guidelines. For example, a rule of thumb may be that a patient gets 6 weeks of physio and then reassess for progress. If I can measure progress and the patient still has objective loss, then I feel like I'm justified in recommending more treatment. But if there's no progress, if there's no clear loss, then there's no more treatment indicated. So even if the patient complains about my decision because of their blue hair or something, I can look at my notes and I can look at the initial measurements and I can look at the reevaluation measurements, and there's my justification for my decision. Remember to write good notes, cover yourself, and leave a good paper trail. The third element of fairness is to communicate effectively. We need to educate our patients continuously. Compassionate communication plays a significant role in patient care. Positive messages and gradual exposure are used to help patients manage their pain effectively. We can't catastrophize our patients by telling them they have scary-sounding structural problems or movement issues. Building an effective therapeutic alliance involves active listening and showing genuine interest in the patient's concerns. Reflecting back what the patient says and providing recommendations based on your clinical experience and evidence are essential aspects of patient care. Also, addressing lifestyle factors is crucial. Ultimately, patients are empowered to make their own decisions regarding their health and treatment. So take the time to have those meaningful discussions with patients. The fourth element of fairness is avoiding the quick fix. Avoid feel-good, passive treatments. We need long-lasting, active treatments that empower our patients. Maybe some temporary use of passive treatments is okay to gain trust or to segue into more active involvement. Patients need to be mentally involved to benefit from their physio. Patients need graduated voluntary exposure to reduce the sensitivity and anxiety to their barriers. Long-term, sustained success comes from active, pain-free exercise with minimal soreness, and don't make it worse. The fifth element of fairness is addressing the patient needs. Patients want 5 things. I don't know where I heard this a few years ago, but it really stuck with me. Why do they hurt? It's not always clear, and don't hide behind jargons to impress them. Reassure the patient it's not serious or sinister. That's ruling out the red flags. Waiting causes a lot of anxiety and depression in patients. So reassuring them is important. The third one is, what can we do about it? Minimize the use of passive modalities to feel good, mostly active pain-free exercises and graduated voluntary exposure. The fourth thing, patients want to know how long it's going to take. Be realistic. It's probably going to take weeks or months. Some things are permanent. And this is the whole person and their emotional components as well. The last thing is patients want to know how much things are going to cost. And we have to be reasonable with these costs. It may be due to their insurance situation, but we need to minimize these costs to make sure that care is sustainable and accessible. What about you? Do you have any tips and tricks on how every patient should be treated fairly? Let us know in the comments below. Books are now available at Amazon. What They Don't Teach You About Documentation in Physiotherapy School, a short how-to manual for successful daily note templates, and From Injury to Recovery Through Exercise, simple functional exercise progressions for physiotherapists to restore lifting, standing, walking. Thank you for your support. Watch an additional video here or subscribe to stay informed. Thank you.